We're here with Dr. Russell for Standing once again. Doctor for Standing, great to see you again. Let's spend a little time talking about a couple of words that I hear very often associated with substance abuse, and that's hopelessness and helplessness. There's a big difference between the two, right?
There's a huge difference, but they're also very much related. You know, sadly, we live in a very difficult, fast-paced world, and a lot of people end up, for whatever reasons, real, unreal, reasonable, unreasonable, feeling somewhat hopeless. And when you feel hopeless, the way our mind works, we can sometimes amplify those feelings. And what we start thinking about is, I'm getting overwhelmed by how hopeless I feel. What might be a solution? And sadly, in our society, there's drugs and mind-altering substances all over the place that can give you a very fast remedy, not a solution, but a very fast remedy. And so I think those feelings of hopelessness are part of what drives the feelings of helplessness, which in turn increases someone's willingness and rationalization to turn to a quick fix of some mind-altering substance. And sadly, around here, we see many times that solution is opiates. And we sadly also see the consequences of what they can do.
Now that would lead me right to the next question, because we hear often in the news these days about legalizing marijuana and medicinal marijuana. What are your thoughts on that?
Well, I think the fact that there's the same word, marijuana, in both of those terms is the real key, and that is, what does marijuana do to the human mind, and consequently how the human interacts in the society they live in. And marijuana, very different than opiates, and in fact very different than alcohol. Opiates and alcohol cause much more acute and observable impacts on how people perceive things, how they think about things, and therefore how they interact. And so it's actually easier for the individual or the people around them to go, you're kind of out of it right now. You really don't want to do that, make this decision. Marijuana, while still very much influencing perceptions, thoughts, and behaviors, it's a little bit more subtle. And so people may not be as aware that they're off base. And then there's this very serious thing that really plays to the legalization side more than the medical side, and that is, if I start to use it on a regular basis, 2 times a week, 3 times a week, daily, more than once a day, what happens is you start to acclimate to the presence of the marijuana in your body, because it stays in your body for a long time, and that becomes your new normal. And you then start making decisions as if you are straight and sober and clear thinking, when in fact you're very much under the influence. So, you know, bottom line, it's, from my perspective, a real source of concern, and yet I think it's going to happen regardless, but we need to really hopefully educate the population about what to watch out for, so they don't end up doing something they're not intending to do.
And there's a real controversy on whether or not marijuana would be considered a gateway drug. Talk about that a little bit.
I think this goes right back to the topic you brought up when we first started this discussion of the hopelessness and the helplessness. If I feel hopeless and I do something and it solves my problem in that moment, it seems like a reasonable solution. If I learn to feel less hopeless because I've turned to marijuana, much like sadly many people have done with alcohol, it starts teaching me that, oh, that's the thing to do. But as with most mind-altering substances, and marijuana is absolutely no exception, you develop tolerance where it doesn't work as well as it once did, and that's where I believe it is a gateway drug, as it does, the ability to make my hopelessness go away starts to decrease. I need something stronger.
Dr. Russ, as always, thanks for taking some time with us and for giving us your expert advice.
Thanks.